Good morning, everyone. Thank you for being here on this holiday here at Government Plaza. I'm Knox Andrus. I'm the Louisiana Region 7 Hospital Preparedness Coordinator. My office is at the Louisiana Poison Center. Appreciate you being with us here this morning downtown at Government Plaza. The one good thing about being at Government Plaza on a holiday is there's plenty of parking, so that's a good thing, and it's economical parking, I might add. So with that, the hospitals and the healthcare leadership from Shreveport-Bossier, Northwest Louisiana, are with me here today to share their response to the current COVID-19 pandemic's rapidly increasing patient numbers that we're experiencing, and ask for your help in managing the current and expected patient surge to come. Now, hospitals and health systems, we've been managing pandemic now since March 2020. Actually, we've gone through 4 previous waves of pandemic. The previous wave that we dealt with was mostly a Delta variant caused wave. But more recently, in the last 30 days, our Region 7 hospitals have seen COVID hospitalizations rise from 21 patients December the 1st to 137 patients that were in our hospitals yesterday. A significant rise. So in the last 2 weeks, alone, we've seen hospitalizations rise 315% in Region 7 hospitals. And we expect the numbers to trend and continue upwards, especially following the holiday gatherings, which we're going to ask people to be careful of. Now, the current Omicron variant that we're dealing with is certainly more transmissible. You've heard that. You're going to continue to hear that. It's more transmissible between individuals, but it does not appear to make people as severely ill as the Delta variant did. So we see that because of the numbers of people that right now are not intubated, for instance, on ventilators. So that's good news. But still, the result of this transmissibility, these increased cases, is that hospital emergency departments are seeing many people that are presenting there that simply want to be tested, or they're concerned for maybe a mild illness that they have. And this is creating logistical challenges for our hospitals and our ERs. Some hospitals are admitting more younger and pediatric patients, especially those that are unvaccinated. Now, speaking of the unvaccinated, the overwhelming number of patients that are admitted, the COVID-19 cases, are among the unvaccinated individuals. Of yesterday's 137 COVID hospitalizations in Region 7, 98, or approximately 72%, were not fully vaccinated. The message there is get vaccinated, stay out of the hospital. If you're vaccinated, you have a very good protection against getting COVID-19 and an excellent protection against severe outcomes such as hospitalization and death. Again, we've talked about that in the past. We will continue to make that point. Now, the Region 7 hospitals, the hospitals here, have been coordinating with local healthcare partners, with the state, with the Office of Public Health, with our government. But our staffed bed resources are challenged and will become more challenged, we expect. We need the community's assistance to help us stop the spread of COVID-19 by getting vaccinated, getting boosted now, and by following the guidance to mask, to socially distance, and by protecting good hand hygiene. It's going to be ultimately to think about yourselves, to think about your loved ones, your children, your neighbors, and your community. And with that, I'm going to turn this over to Dr. Steve Trawick, and he'll turn it over to the next speaker in that order. And then at the end of this, we're going to summarize with Dr. Martha White, and then she'll call for questions from the media that they might have for us individually. So again, thank you. Dr. Trawick.
Good morning. I have to start off where Knox left off and talk about the community perception and what we're hearing in the community. And what I'm hearing is, well, with this Omicron, there's really no reason to get vaccinated because, the vaccine doesn't work. And I'm here to tell you that's not true. And we know that's not true because of the numbers we're seeing, which I'll go over in just a second. But I also would like to say it really depends on your endpoint. If you're talking about not getting coronavirus at all, well, we are seeing some breakthrough cases on our vaccinated patients. But if your endpoint, and I'm saying this as a physician, as a father and a husband, if your endpoint is to not get critically ill, get admitted to the ICU and die, the vaccine is working very well. And so I would encourage you, just as Knox said, to not only get vaccinated, but get boosted. My entire family has been boosted, including my children, and we've done just fine. And to this day, not gotten coronavirus. Let me talk a little bit about what's going on at Christus Health. Right now, we are seeing a deluge of patients in our emergency departments and in our urgent cares. We've seen a doubling of those numbers. Highest numbers we've ever seen in our emergency department, and a large majority of those are just seeking a COVID test. And what you're going to hear today, not only from me, but from the rest of my colleagues, are that is not an efficient use of resources. There are resources that our state and our community and our Department of Health have put out there, as well as our medical center, that are available to each of you to get a COVID test. The emergency department are for emergencies, and we want to encourage you, if you are sick, if you are ill, if you have shortness of breath or other medical conditions, please come to the emergency department. That's what it's there for. If you just had an exposure or think you might have coronavirus but really are asymptomatic, there are other resources out there, and those will be covered later today. In our hospital right now, we are seeing about 60% of our patients unvaccinated. So to Knox's point, the greatest majority of them are unvaccinated. We're also seeing about 40% of those breakthrough cases, but out of those 40, only 10% have been boosted. So the booster is working, and I want you to hear that loudly and very clearly from me today. In our urgent cares, we're seeing about a 50% positivity rates on all of our tests. In our emergency departments, about a 43% positivity rate. So it is out in this community. I want to comment on a couple of things, and we've been saying this since the very beginning. Do the things that we know work. Wear a mask. Stay away from large crowds. If you're sick, stay home. Remember, it's not just you that you have to worry about, but it's other people, it's your family members. I understand that today is New Year's Eve, and there's a lot of activities and stuff that people have planned. Just be smart. And remember to do the right thing when you're out. We're not telling you to stay home and lock your doors and don't do and live your normal life. What we're saying is be smart. It works when you take care of the common sense things. I also want to say thank you to our associates, and I think probably all of my colleagues feel this way. Our nurses and our staff, our leaders at our hospital have gone above and beyond. And this is yet another trying time for us in healthcare, but we will get through this. The resiliency of our staff and our associates just amazes me, and I feel so blessed to be able to work with the caliber of people that we get to work with, because these folks care about this community, and they care about making sure that you have the care that you need when you're sick. And that is something that I just can't express enough thank you for. So again, I'll close by saying, get boosted, get vaccinated. There are resources out there on the Department of Health website. 211 on your phone will tell you where you can get the testing, and we're going to cover some great, exciting news that will be coming up this next week about testing. So thank you very much. And I'd like to introduce Dave Calicod, who is the CEO of the Academic Medical Center and St. Mary's Medical Center here for Ochsner.
Thank you, Steen. And Knox, thanks for putting this event together. Good morning, everyone. As Steen said, I'm David Calicott. I serve as the interim CEO at Ochsner LSU. Certainly, Dr. Trawick stole all of my talking points. I just want to tell you that, what's going around, this milder virus that's going around, certainly has resulted in, less acute symptoms, but it is still causing hospitalizations, and it is still resulting in deaths, and it should be taken seriously. Just some statistics for Oxnard LSU. We currently have 52 hospitalized patients across the system. 47 of those are here in Shreveport. And as Dr. Trewick stated, 80% of the admitted patients that we have are unvaccinated, of those COVID patients. Those numbers have doubled just in 1 week. The other thing about our situation now is that we're seeing many more employees go out with COVID as well. And so that number has increased significantly this week. And across our entire system, we now have 84 providers, 84 employees that are out on quarantine. We talked about this, and what we're seeing is the use of our emergency departments and our urgent cares, unfortunately, just for testing. And we just want to urge you to use the emergency department if you're truly sick. It's not a place that you should go just to get a COVID test. Oxnard LSU, our academic medical center on Kings Highway, is the level 1 trauma center. It's a level 1 trauma center, the only one above I-10. We also have a pediatric trauma center, the highest level of pediatric trauma in the state of Louisiana. We're here to serve patients across the entire region, very, very critically ill patients across the entire region. And we've seen just extraordinary numbers at our emergency department at the main campus. This is taking resources away from those critical patients, your loved ones that may be in an accident or have some other reason that has caused a trauma that brings them to our facility, and we need those people to be available to take care of those patients. So again, please do not come to the emergency room simply to get a COVID test. If you have urgent symptoms, we have our urgent care facilities across the region that are open 7 days a week. We've seen record-setting volumes at every single one of those urgent cares over this past week, with over 200 visits per day at each of them. But don't go to the urgent care unless you have symptoms that need to be treated. And so if you have mild symptoms, certainly you can do a number of things. One, we recommend virtual visits. You can go to oxnardlsuhs.org/anywhere and do a virtual visit to address your symptoms. Also, would encourage you to go to oxnard.org/self-care. And when you go there, it will take you through a set of questions, provide you text updates, and help you manage your symptoms if you are COVID positive. Again, keeping you out of the urgent cares, keeping you out of the emergency department. If you have mild symptoms, I would just suggest treating yourself as being COVID positive. Quarantine and wear a mask. You do not need a positive test to do the right thing if you're feeling sick. So we're just at the beginning, unfortunately, of this surge. As we've looked at what has happened across the world, and certainly what we've seen happening over the last couple weeks in South Louisiana, we're at the beginning of this. We're going to continue to see doubling of these numbers, I anticipate. And so I want you to all to please celebrate New Year's Eve very, very carefully. Take precautions. Be very careful masking up indoors and avoiding large gatherings. And as Dr. Trewick said, can't urge you enough to get vaccinated and get boosted. Now I'd like to turn it over to Jaff Fielder, who is the President and CEO of Willis Knighton Health System. Jaff?
Thank you, David. Thank you, Knox, for inviting me to the press conference here today. As David said, I'm Jaff Fielder, President and CEO of the Willis Knighton Health System, and today I'm here to talk to you a little bit about Willis Knighton and what we're seeing. Since the early days of 2020, COVID has forever changed our world, and no industry has been more greatly impacted, negatively impacted, than the healthcare industry. Healthcare employees have borne the brunt of this pandemic, and I am so proud of the Willis Knighton employees and medical staff who continue to step up to every challenge on every occasion. It's not easy work. Our doctors and our nurses, our respiratory therapists, our critical care specialists, our infectious disease specialists have basically written the book on how to treat COVID. Some things have worked and some things have not. Just in the Willis Knighton Health System over the last 5 days, our 4 emergency departments have treated twice as many patients as normal over the last 5 days, with a 32% positivity rate in those 4 emergency departments. Our urgent cares, our quick care facilities have seen 3 times as many patients over the last 5 days with a 52% positivity rate. Our Willis Knighton inpatient admissions with a COVID-19 diagnosis have increased 133% over the last 5 days. Willis Knighton is always focused on the needs of the community and the well-being of its citizens. We are always here doing the best we can possibly do for you. But at this time, we ask that you help us do your part in containing the spread of this virus. If you've got mild symptoms like sinus issues or a mild cough, you need to isolate yourself from others immediately. If your primary care physician wants you to be tested, they can write an order to one of our 2 drive-through testing facilities and get you the testing that you need at Willis Knighton Piermont or Willis Knighton Bossier. But if you're having major symptoms like breathing issues, you need to seek medical treatment immediately. Like you, we're all tired of this pandemic, and Willis Knighton has been at the forefront for caring for patients and increasing access to convenient care over the last 98 years. We've all done this from time and time again, but once again, we're asking for your help to contain this COVID-19 surge. As citizens of Shreveport-Bossier, we need you to be more vigilant in taking responsibility for your health. This means to mitigate your risk by avoiding crowds. When you're outside your family group, you need to wear a mask, and above all things, you need to be vaccinated. And if you have somebody in your family that has not gotten vaccinated, we encourage you to encourage them to get vaccinated. The spread of the Omicron variant is spreading much faster than that of the Delta variant. And it's making a significant impact on the way we deliver health care here locally. Lab tests are revealing high levels of positivity throughout the local area, and hospital admissions are going up dramatically. Our hospital staff are treating patients with COVID, many of whom are not vaccinated. One of the main things we found with patients that are coming into the hospital on an inpatient basis with a COVID-19 diagnosis, those that have been vaccinated are having milder symptoms and a shorter length of stay than those that have not been vaccinated. So that tells you right there that the vaccine is working. In a recent study published by the New England Journal of Medicine, it showed that the vaccine in combination with the booster was extremely effective against the Omicron variant. So we encourage you to get your booster if you're due. In closing, I'd like to ask you to pray for the patients that we're all treating and pray for the healthcare workers who are taking care of the patients and are stepping up for the needs of this community. And as we deal with this surge, we also ask that you be patient with us. We're doing our very best to continue to deliver the high quality of care that you've become accustomed to receiving. And that is very difficult as a large number of our employees have been infected by the virus and are unable to come to work. So once again, we're all in this together, so let's work together to defeat this Omicron surge. So at this time, I'll turn it over to Chris Kevill with LSU Health.
Thank you, Mr. Fielder, and thank you, Knox, for the opportunity to give you an update today about the Omicron variant and as well as testing through the LSU Health Center for Emerging Viral Threats. As many of you know, the LSU CEVT, as we call it, has been working in concert with the 3 health partners that you've just heard from in North Louisiana, as well as working very closely with the Louisiana Department of Health, as well as the National Institutes of Health in Washington, D.C. So for those of you that are wondering, as of this morning, we've seen a 50% positivity rate in testing. Dr. John Venturi will tell you a little bit more about that in a moment. But as we've heard from all three previous speakers, we've seen that the positivity rate has essentially doubled over the past 3 weeks. One of the things that the Center for Emerging Viral Threats really has the capability to do here in North Louisiana that is a gem for us is to sequence the viral positivity that we get. Just as an example, 3 weeks ago we found that all the positives essentially represented 20% Omicron in our region. 1 week ago, before Christmas, it was 40%. And as of this morning, which we now got the data from the last batch of sequence, it's 80%. So clearly Omicron is here to stay, and this is the variant that we will be seeing continue to proliferate and to explode in our region. The good news is that CEVT stands toe-to-toe, shoulder-to-shoulder with all of these health systems and with the community to help provide tests. As you've heard a moment ago, using the emergency room as a testing facility is really not the best source of resources, and that's what CEVT is here to do. So, without any further ado, I'll introduce Dr. John Vancheri, who will tell you how to get tests through CEVT.
Great, thank you, Dr. Kevel. It's prescient that we were, a year ago, started our vaccination program at the fairgrounds, and now we're back with our partners in the community, shoulder to shoulder again, to continue to fight this pandemic. So, as Dr. Kevel said, we have expanded our testing at our site on Linwood Avenue. For those who haven't seen already, we have testing today from 10 o'clock to 3 o'clock. That is available. It's drive-through testing, and we have 3 lanes, 3 open bays with rapid testing available. It's a point-of-care test available. We've also added testing time on Sunday, January 2nd, from noon to 5 p.m. at our site on Linwood Avenue. It's the old Chevyland car dealership at 2627 Linwood Avenue. And starting Sunday, we will be doing primarily PCR tests, and there are several reasons for that. The PCR test is much more reliable than the rapid test. It gives you a more accurate result. It also helps provide us the information related to the sequencing and the local epidemiology of the virus over time. And so PCR testing will be our go-to, and that's also because the rapid tests, as most people have seen, are in very short supply. In our urgent care centers, in pharmacies, and the like, the home tests are in very short supply, and we don't expect that to change very rapidly. But we have capacity through the Center for Emerging Viral Threats to do thousands of tests per day. And so the folks want a rapid test. They want a result very quickly. PCR results will come back the following day. Testing is not an emergency, as the previous speakers have said. Emergency rooms are for emergencies. Testing is not an emergency. And so testing results are also not an emergency. Waiting a day for your test result is a time to just take care of yourself. If you're having symptoms, take a deep breath, get some comfort food if you need it, you know, the routine things that we always do, and take care of yourself and your family. But those test results from PCR will come back typically 24 hours after your test is performed, and that's okay. If you have an emergency, especially respiratory problems, then you should seek care in an urgent care or emergency room. But even if you have, just because you have fever doesn't mean you need to go to an urgent care or an emergency room, right? Fever is part of this syndrome. Cough, sore throat, nasal congestion, all of those things. Expect those symptoms. They don't very often require medical attention. Okay, so I just want to be very specific about that. Just because you have a fever doesn't mean you need to run out and see your doctor. If you are a high-risk patient, you're a cancer chemotherapy patient, you have an autoimmune disease, you have chronic illnesses, especially heart disease, obesity, asthma, then contact your doctor if you have symptoms or a positive test. Start with your own primary care physician who knows you and who can guide you about what is appropriate care for your individual condition. And that will help significantly take the burden off of our emergency rooms and urgent care facilities. We will, so Sunday afternoon, noon to 5. Monday at our site on Linwood Avenue, we'll be back to our regular schedule of 10 a.m. to 6 p.m. with a full menu of testing and vaccines. vaccines for age 5 and up, and also flu vaccines available for age 5 and up. So we have the full complement there. And in terms of the vaccines, you've heard about how effective they are, which is very positive. What I will tell you, we're seeing in our vaccination site, about 25 to 30% of people who are coming for vaccines the past 2 weeks have been first doses. So that tells us there are a lot of people who are changing their mind, who are realizing that, okay, folks who've been vaccinated are better protected, but they're also not growing web toes or extra horns or other things that some people have worried about. And of those 25 to 30% who are first-time vaccinations, half of them are children who've just become eligible, but half of them are adults who've been eligible for vaccines for 6 to 12 months and who have looked at what is happening around them and understand that now's a good time. We know the safety profile of these vaccines is very, very good, and we know their effectiveness. So take a look within yourself if you're not vaccinated and ask yourself why. Talk to others who've been vaccinated. Talk to people who've been sick with COVID and make your decision. But please, please get vaccinated and get boosted, because that is what saves lives. That is what protects our healthcare system to serve the people who are critically ill with COVID and other illnesses. So with that, I'll turn this over to Dr. Martha White, who has been a tremendous, tremendous leader from the Department of Health over these past 2 years. None of us would be here without her leadership in our area, because she is a dedicated spokesman and advocate for all of the people in Northwest Louisiana. So Dr. White, thank you very much.
Thank y'all. So really what I wanted to come say is thank you to all of these fine gentlemen who came and spoke to you and gave you great knowledge. My concern, and the reason why I asked for us to bring this together, was the number of people and the wait times that they were seeing in their ERs and in their urgent cares. And so we wanted to talk to the public and let them know, yes, there are long wait times in the quick cares, in the urgent cares, whatever their title. They all have a different title, but they're all there for the same purpose. What we want you to do is, if you're sick and you need to be seen, if you are short of breath, if you're having chest pain, if you're having mental status changes that your family is seeing, confusion, anything that makes your family concerned, then definitely you need to go and be seen. We're not asking you not to be seen if it's urgent. What we're saying is, if you have simple symptoms like sinus, cold, just don't feel good, low-grade fever, those aches and pains, stay home, treat yourself, use your Tylenol, your Advil, and drink lots of fluids, take good care of yourself, rest, and keep yourself away from the rest of your family as much as you can. This is a very contagious variant. We're seeing, instead of when someone is exposed, like at a party, 1 or 2, 3 people getting sick, we're seeing 20 people get sick. So it is very contagious. That's why if you're sick, please stay home. Even if you just have those cold symptoms and you think, oh, I can go out, I want to go see my friends, this is not the time to be doing that. I know we all want to return to normal. No one more than all of these fine gentlemen and all of the people working for them who are caring for these people who are really, really sick. We don't want to be in this business this time next year. We want to see this pandemic come to an end. So please, get vaccinated if you're not vaccinated. If you are vaccinated, hadn't had your booster yet, please go ahead and get that done if it's time. We are seeing the great effects of that booster. We know if you're vaccinated, it's about 70 to 75% protective. Once you get that booster, that climbs up into the mid to high 80% protective. That's from getting sick at all. Those few people that do have that 20% above that, 15% above the 85 if you're boosted, those people are not getting near as sick, and very few of them are ending up in the hospital, and we really are not seeing deaths among those people. Not in the state of Louisiana, we haven't. So please take the time and get vaccinated. Please don't be afraid. This technology that they use to develop this vaccine has been around for decades. It's not new like everybody's trying to tell you. It is a safe vaccine, one of the cleanest vaccines we've ever seen. So please don't be afraid. Please take this chance and step up and do it. If you are sick, please stay home. Assume you have COVID. Wear your mask. Stay home for 5 days. If you're still febrile in 5 days, continue to stay home until you are not febrile or have fever. And then if you're feeling fine in 5 days, you can go back to work, you can go back to activities, but wear your mask for another 5 days because you could still be contagious. Please consider all of these people that are working so hard to protect you. If you think a 7-hour wait is hard on you, just think about the people trying to get all of those people through that clinic in 7 hours. So they're working so hard to take care of you. You do your part. Take care of yourself at home. Go to the hospital or the ER, the urgent care if you need to be seen there. Remember what they told you. ER's only for truly emergent care. That's, our heart attacks, our traumas, our gallbladder attacks, all those things that they see every day. Unless you really can't breathe and you need some urgent emergent care, you want to go to your doc or your quick care. We all have primary care physicians, or we should. And if you are sick, call your doc. If you're high risk, please let them know that you're not feeling well so that they can monitor you and tell you what to do. The reason why we're here is we don't want them any more overwhelmed than they are right now. So please help us, help them take care of us. Thank you. Does anybody have any questions?
What do you believe, is there a reluctance among the vaccinated to get boosted?
We have not really seen a reluctance to get boosted. I think people maybe don't see it quite as urgent to get that shot as they did, because it was on such a timetable. But we are seeing people receive those boosters. In fact, about 2/3 of our vaccinations being given are people getting boosters right now.
Yeah. One thing I'll add to that is that folks who get a booster should expect to have side effects about the same as their second dose. So for some who had significant side effects, fever for a couple of days, real achiness, there is a little hesitancy to get a booster. But what helps reduce the likelihood of those side effects is the time interval between. So when you're getting boosted 6 months from your second dose, you're likely to have fewer side effects compared to the second dose. So that's the area where there's a little hesitancy. But those side effects you can treat with Tylenol and ibuprofen and fluids, and they last just a couple of days, and then you move forward.
And you can also pre-med yourself. My husband, he was very adamant on getting all of his shots, including his booster, despite having been so sick. He had a pretty significant reaction to his second dose. With his third dose, we just gave him, before he got his dose, he took some ibuprofen, helps with inflammation and pain and fever protection. He did much better. So keeping himself hydrated, keeping himself on those antipyretics like Tylenol or ibuprofen really helped protect him from those kind of worse side effects that he felt. But take care of yourself. Plan on that you might not feel too great for a day or two. A lot of people are looking on when they can be off, like a weekend, a Friday or something. But it's definitely something that you need to do.
Could I ask, I believe Dr. Kibble, who mentioned, you said that omicron is here to stay. I'd like you to expand on that. What do you mean by that? Because I saw a report today that South Africa believes that they're on the downhill side of omicron.
Right. So what we mean by Omicron is here to stay is that the Omicron variant is more effective at infecting individuals than the Delta variant. And the likelihood is that if and when this virus goes endemic, which is what it looks like it's going to be, that it's going to be a virus much like Omicron that does that. So right now, because Omicron spreads so much better and infects people much better than Delta, it's looking like Omicron is the variant that's going to be with us for a while until perhaps we see another variant pop up. And again, that's part of the reason why the work at LSU's CEVT is so critical, because we can identify those variants as soon as we see people that get positive.
what are we doing with, what do we do with people who saying that that you guys are lying, that the vaccines do not prevent infection? We have someone saying that there's been 18,000 people died from the vaccine. They credit the source as CDC. So we still have these people who are saying this.
I'm going to bring up Dr. Vancheri, who was actually one of the lead investigators in one of the pivotal vaccine trials in the United States. So I think he can speak to that very clearly.
Okay.
Dr. Vancheri.
So the data that is available and very clear show that the vaccines are saving lives. There have, I'll speak to the clinical trials. In the clinical trial with the Pfizer vaccine, there were 44,000 individuals who participated in that trial. There were several deaths in that trial from car crashes, from heart attacks, from things not related to the vaccine, and there were actually more deaths in the placebo group than in the vaccine group, as expected with the protection of the vaccine. So I think we have to remember that just because a person dies 2 months after getting a vaccine doesn't mean the vaccine caused their death, because it didn't. The safety profile on these vaccines is impeccable. No vaccine is perfect, and I would challenge folks who want to talk about 18,000 deaths related to the vaccine. That number is false. There is no credibility to that number. So.
Right, and everybody wants to talk about OpenVAERS. OpenVAERS is probably the website that they're talking about. OpenVAERS is anybody can report a side effect to the vaccine. So if I got vaccinated, I walked out, had a heart attack 2 days later, it can be reported into VAERS. That's what the point is. We want as much reported in so that those cases can be looked at. All of those cases then are looked at through CDC. CDC then determines whether those are truly adverse events to the vaccine. We have had very mild reactions to the vaccine. We've had no deaths in the state of Louisiana. We've had a few hospitalizations. All of those went home within the day. They were very mild. And so I just want people to understand, yes, that is a number of people that may have had a report into the system. It does not mean that that is a legitimate vaccine reaction. And as far as calling people liars, all we are here to do is to give you the data and the science, and you can choose to do with that as you will. We're here to tell you about this virus. We're here to tell you about what it's going to do. We've told you every time we've spoken to you what the data shows, what the science shows, and what you choose to do with that is what you choose to do. So nobody should be calling people names or accusing people of lying, because we're not here to do that. We're just here to tell you what we've learned about this virus as we studied it.
And related to the pediatric use of the virus in the pediatric clinical trial, one of the adverse events that was reported was that a child swallowed a penny. It had to be reported because the child went to the hospital for it and they were in the vaccine trial. So again, a temporal association, a time interval association doesn't mean causation by any means, and that's part of the difficulty of using the VAERS system. So.
But a very important system.
Yes.
Very important.
Yeah.
And it's a checks and balances system.
Right. So
We want those reports so that they can be reviewed and looked at.
that's right. So the question is about the accuracy of home tests. Number one, home tests are in very short supply if you've gone to a pharmacy to look for them. The accuracy of the home test is good if the result is positive, but where you can't trust a home test is a negative result, because there are a lot of reasons that it can be negative. Even if you just don't get an adequate swab in your nose, you may have a negative test. It may be related to the timing. If you test too early after your exposure, then you may have a negative test because there's not enough virus to be detected yet. So that's where the home tests are less accurate, especially for a negative result. If a home test is positive, you can trust it, it's real.
question is, have any of you had access to the antiviral pill medication yet? And I think the answer is no.
So those pills have been sent to independent pharmacies, but the doctors will have to write a prescription for very specific patients to receive those pills. They do have interactions with other drugs, and they really are meant for a very specific population, so people who are highly immunocompromised, who the vaccine perhaps won't work as well for because their immune system just doesn't work as well. Those are the people they're trying to get those drugs to. They came into the state at a very small supply. They're going to come every week, and we hope we get more and more, but the number of doses are very limited, and they will have to be through your physician through the pharmacy.
Strict criteria.
Very strict
You may
criteria.
want to talk about the governor's call yesterday, how that was brought up, and they're trying to get involved in the hospitals.
Right. I mean, I don't know. I'm sure most of you were on the press conference that the governor had yesterday. The governor is a very strong advocate for the state. He is working very hard to get both the other monoclonal antibody treatment, Sotrovimab, and the oral medications in higher numbers brought here. We're also trying to bring more testing supplies. I do want people to understand, if you want a rapid test, it's going to be hard to find. The most common rapid tests are the ones that you're finding in the pharmacy to take home. We're trying to get more of those in. Large orders are placed. Whether we receive them or not, we'll let you know as they come in and they get out into the community. But your PCR is actually the best test, and it's coming back within. We're not. But early on we were seeing like a week delay. We're not seeing that anymore. We're seeing 24 hours, at the most 48. We are not seeing that long wait, so please don't feel defeated. If you get a PCR test, it's going to give you the answer that you need to know.
If I may, to follow up on what Dr. White said here at the CEVT. So now we're doing, on average, about 3,000 tests a day. And she's absolutely right. We are actually getting turnaround times on these tests that are less than 24 hours. We're working very closely with the Louisiana Department of Health to do testing through K through 12, which Dr. Van Cherry also oversees. So if you really want to get a test, the safest bet and the bet to alleviate the compression or the influx of patients in the quick cares and the emergency rooms is to go to the CEVT facility, because you will get a test that's a PCR test that you can trust and that will have a turnaround time of 24 hours or less.
Thank you. Any other questions this morning?